Thank you to Anne Marie, a manager at St. Francis Hospital in Roslyn. Thank you to Anthony from Mastic, a Stop and Shop employee. Thank you to Bernard, who operates a disaster recovery company that cleans and sanitizes apartment buildings and businesses in New York City and Long Island. He's also a volunteer EMT at Huntington Community First Aid Squad. Thank you to Dava, an infectious disease doctor working on the front lines at St. Francis LIJ and North Shore University Hospitals, taking care of COVID-19 patients. Thank you to Francine from Port Washington, who works for the Sands Point Center for Health and Rehabilitation. Are you an essential worker or know someone who is? And we want to hear from you. All we need is the picture, the person's name, the village or town, and what that person does for a living. Every night, right here at 7, we will be thanking the people who have been on the front lines during this pandemic. Just go to the News 12 Facebook or Twitter page. Good evening, I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Stony Brook Southampton Hospital. You'll recognize him to help you sort through what's going on with COVID-19 in our communities and across the region. And of course, we always want to hear from you. This is a call-in show, so call in. That number right there at the bottom of your screen, 516-393-1800. Well, it was anything but business as usual, but phase 1 of reopening, it is now underway, and Long Islanders are slowly getting back to work. Meanwhile, the governor met with the president at the White House this morning. Now, the two Queens natives spoke about fast-tracking major infrastructure projects. Cuomo says we need to supercharge the reopening, especially here in New York, which has been really the hardest hit by the pandemic. The new cases of the virus, they're on the downslope, but still statewide. Look at the numbers here. Almost 365,000 New Yorkers tested positive for COVID-19. Long Islanders, we account for a little less than 80,000 of those cases. Now, in Nassau, Executive Curran says only 3% of patients tested in Nassau, they tested positive. That was in the last 24 hours. And Suffolk Executive Balone says Suffolk hit a turning point with just a little more than 300 people remaining in county hospitals due to the virus. Now, look at the statewide. These are the death tolls today. This reached 23,600. That's just in our state in the last about 3.5 months. Nassau has seen a 14-day decline in deaths. That's according to the county executive. And Suffolk Executive Balone says ICU patients are now down below 100 for the first time since March. Long Island's death toll, though, still just almost at 4,000. All right, let's get back to our conversation. Joining us now tonight is Dr. Rajeev Fernando, an infectious disease specialist at Stony Brook Southampton Hospital, friend of the show. Always so gracious, taking the time to talk with us and really kind of teach us about this stuff. Thank you very much for joining us. How are you holding up? How are you and your colleagues holding up?
We're doing very well. Thank you. We're part of a hospital that we get so much of encouragement from our leaders, administrators, and they really guided us through this very well. It's been long hours for all of us, doctors, nurses, LPNs, everyone's been overtime, but we feel our administrators have done a good job keeping us content, and not to mention all the free food that is delivered to us to keep us happy and not hungry. So thank you.
Yeah, well, a well-deserved perk, I guess, for that. You and I were talking before the show, and there's been a lot of confusion, especially lately. I just want to have you clear this up. Hydroxychloroquine, is that something that we should even be looking at right now, given all we know about it?
Sure. So hydroxychloroquine really came out sometime in January, and this is really, people are talking about it. It was a small French study that was done. We started using it around end of February, March, and really it was a very small study done out of France with around 20 people. But doctors, this is what we like to do. There was some evidence which said it might work, and we had people coming to our ER. They were in our ICU settings, and they were just dying right in front of us. So we said, well, there's limited data on it, but let's go for it. I mean, this is what we have right now. That was early, end of March, early April. Things have changed so much since then. So since then, we've had this huge global study, which was conducted in 96,000 hospitalized patients, which showed that hydroxychloroquine had no benefit at all to these patients. As a matter of fact, it showed that it actually increased risk of death in certain patients who had, a pre-existing heart arrhythmia, and people can die because they use hydroxychloroquine. So I'm not to be political or anything like that, but I really think it's a bad idea to be using this drug right now. There's very conclusive, like I said, that was a study when we started using it out of desperation. Physicians, healthcare workers from all over the country said, well, this is what we have, let's go for it. That was a 20-patient study, but now we're talking about a 96,000 people study in one of the best journals, medical journals in the world. So I really think for the public out there to really be, even if someone suggests to take hydroxychloroquine, take a step back and think about it. Not, this isn't the drug you want to be on.
Yeah, it should be all be medical. There's nothing political about it. It's all medical. Okay, let's go to some of the phones. Ed from Malvern, are you there?
Yes, I'm here.
Oh, okay, what's your question tonight?
About 5 weeks ago, I did test positive for the coronavirus, and after quarantine period, I took the test for the antibodies, and I tested positive for the antibodies. My question is, do those antibodies cover any variation or mutation of the coronavirus that's out there?
Yeah, it's a very good question. So right now there are definitely mutations with coronavirus, but none of them are so significant where they actually change the behavior of the virus. So you have to ask yourself, when does a virus really mutate? And a virus mutates when its ability to infect people is compromised. So all of a sudden the virus wakes up one day and says, wait a minute, I'm not infecting that many people anymore. Let's switch it up. And that's when you have a mutation which changes its virulence or its pathology, changes its virulence and makes it more infectious. But right now around the world, we just had 1 million cases over the last 2 weeks around the world. So the virus is not showing any signs, or it doesn't need to mutate at this point. The serology test that you're talking about, really, there's a lot to be learned about these tests. The CDC doesn't even recommend it at this point with regards to going back to work. There's a lot we need to do with the serology. More information is coming out, but I suggest you talk to your physicians when you do the test. Make sure you discuss your exact clinical situation with your physician.
Okay. How about Randy from Holbrook? Randy, there?
Yes. Hi, my daughter saw the doctor for a well visit last Wednesday. On Thursday, we got a call she was exposed to an asymptomatic nurse. Both had masks on except for when they orally took her temperature. My daughter has no symptoms. Is there a chance she is asymptomatic and can give it to me?
That's a very good question. I need one more part of the question. Was this an antibody test, or was this a nose test, which what we call a PCR?
She went for a regular visit, and they called her the next day saying that the nurse was exposed positive to an was asymptomatic.
Sure, yeah. Great question. So there are three possibilities. When one has a nose test positive, there are three possibilities. One is unlikely. Let's take that off the differential right now, and I don't want you to panic or be concerned. She's not symptomatic, so she's not going to give you, she's not infectious at the point. The two situations that we have right now are two. One is this test is so sensitive, so it mistakenly calls it a positive test, even if there are dead fragments present in the nose. So that's another possibility. She might have had it before. Remember, 80% of people who have COVID-19 really are asymptomatic. Of course, we know about all the terrible cases we see, the deaths, the sick people. 15% of people get hospitalized. 5% go to the ICU. So we've seen some really terrible cases out there. But it's really important for all of you out there to realize that 80% of people with COVID-19 syndrome, they have a very mild, like a sinus syndrome, and it just goes away. Some sinus symptoms, some body aches, and really goes away. So that's the second possibility, if she just has dead fragments. And the third one is, like your physician said, that she's an asymptomatic carrier. So that's what we have right now. She is not infectious to you right now, as long as you continue to maintain the usual trifecta that I've been recommending: social distancing, hand hygiene, and the last, of course, is the mask. The mask is very important. As a matter of fact, if you see people out there who you're seeing without a mask, it's not unreasonable to ask them to politely put on a mask for the safety of others.
Yeah, that's great advice. Larry from Mount Sinai. Larry?
Yes, hi, good evening. Hi, doctor.
Hi, Larry. How are you?
Hi there. My question is around the antibody testing. So myself and a couple family members were tested, and they came back at a 0.1, and I myself came back at a 1.1. Is there anything I should read into the 1.1 being so close to 1.4? Could that mean a mild case, or is it irrelevant?
Yeah, certainly. I'm going to be very upfront with you right now. And what's really happened was, a little history is required over here. So the CDC, initially there was some problem testing with the PCR test. It was late to kick off. So unfortunately, not to cause any trouble or anything, but just a couple of my thoughts. So when it came to approving the serology test, they actually approved many companies out there as what we call a emergency authorization use. So a lot of the companies really aren't the best, and we're seeing that these tests sometimes can be inaccurate or invalid. So I still think right now you have the test, keep it with you, but I think there's more of the puzzle to come out. So just keep that test with you. I think there's going to be some more recommendations in the next week or two.
Okay. We're going to take a real quick break. When we come back, we're going to have more expert advice on how to keep you and your family safe from the coronavirus. And remember, we want to hear from you. This is a call-in show, so call in with your questions. That number right there on the bottom of your screen, 516-393-1800. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Rajeev Fernando, an infectious disease specialist at Stony Brook Southampton Hospital, and of course, friend of the show at this point. I know Suzanne has been holding since the first block, so let's go to her in Holbrook. Suzanne?
I had been in Stony Brook, not Southampton one, Stony Brook Hospital at the very end of February. And I had kidney stones blasted. It was ambulatory. I was sent home with a stent for 9 days. The second day I was home, I started running over 101 fever. Then 2 days after that, I woke up with a sore throat that I couldn't swallow. Now, no one at that point had been wearing masks in the admitting room, and there was a lot of people in the waiting room, and everybody was shaking hands without gloves, even my anesthesiology team. But what I brought down the 101 fever with was my 800 milligrams of ibuprofen. Now, I had looked up on my AARP. I'm 63 years old.
Is your question that whether ibuprofen is actually safe to take against?
Well, AARP said it was, but now I'm reading that it's 10 times faster.
Okay, let me see what the doctor has to say about ibuprofen.
Great question. Thank you for asking that. And I understand your concern, because initially there was definitely some talk about against using ibuprofen. Some bizarre study which came out of the UK, Ireland, I believe. But once again, that was an absolute false study. Ibuprofen works really well. As a matter of fact, one of the phases of COVID-19 is something called a cytokine storm. And ibuprofen is a potent anti-inflammatory agent. So I'm sorry you had to hear that type of false or disinformation. Ibuprofen is a great drug. So go ahead with it. Remember, when you take ibuprofen, take it on a full stomach. That's important to know. And it can cause kidney injuries as well. So be a little cautious when you take that. It can alter your renal function.
Okay. How about Yolanda from Amityville?
Yes. Hello. My question.
Hi, Yolanda.
Hello.
Yep.
Hi, Yolanda.
My question is if you go and you get tested for COVID and it's positive, and then you go back and get tested again and you're positive, you got to keep quarantining yourself?
Yeah, this is a very good question. It's a great question, and this kind of thing I really have to depend on the state to what they say exactly on the situation. But just off the bat, I would say, if you are positive indeed again and again, and you're trying to get back to work, sometimes that's going to be a problem. People are just going to say, well, it's positive, and sometimes you just have to wait that through. In my professional opinion, I feel once you're past the 10 to 11, 12 days or so, the chances of being infectious are not that common. But once again, this is just my thought and my clinical experience. But these are tough questions that really the CDC has to give us the protocol about. And like I'd mentioned before, sometimes it's just asymptomatic colonization. These are tough times. We just don't have all the right answers. So I ask you to be patient. Thank you for your question, though.
All right, Stephanie from Deer Park. Stephanie?
Yes, thank you, doctor, for your service and taking my call. I had the virus 2 weeks ago, and I wanted to visit my brother-in-law who's terminally ill in Florida. And when would it be safe for me to do that, and do I have to be retested before I go down to Florida?
So how are you doing? You've recovered from the illness?
Yes, I had a very mild case. I had fatigue and cough and headaches. Very mild case.
Okay. Well, it sounds like an essential trip to me. I hope he does well. It sounds like an essential trip to me that you have to. So I would just use all the precautions. When you see him, definitely wear a mask, hand hygiene, and try to stay away as much as you can. This step is an essential trip, I feel, and I understand the pain you're going through. So please go ahead, make your trip, but the social distancing, or the trifecta that I like to call it, mask, hand hygiene, and 6 feet distance. That's the best thing we can do right now. Good luck, and I hope he does well.
Yeah, good luck with that, Stephanie. How about Steve from Oceanside? Are you there?
Yes, good evening.
Good evening. What's your question?
The question is in regards to now the pool season will kind of start. With kids that kind of get splashed around and kind of spit into the pool, and is it safe? Does chlorine kind of kill the virus? Do we know anything about it?
Great question, Steve. And I am going to tell you, it's going to be happy news for all of you who have pools in the Hamptons. Unfortunately, I don't have one, so I may actually visit you. But chlorine actually kills the virus upwards of 99%. So you're in good shape unless something changes over the last 24 hours. My data is pretty solid with regards to that. The only thing which can be challenging is when you get in the swimming pool, you have to maintain the 6 feet distance. Hypothetically, you could also say, but that might be overkill, where someone can have diarrhea with COVID. I mean, that's one situation which, if you really want to stretch this question. But fundamentally, chlorine kills the virus. Another thing is when you're out in the swimming pool, it's probably sunny as well, and so you have multiple factors to go against the virus. But the 6 feet distance stays. Thanks for your question.
Yeah, unfortunately, that is all the time we have. We're going to have to bring you back on because I have my own questions that I didn't even get to, and I know that there were a couple of things that we want to talk about. So we're going to obviously bring you back at another time. But that is all the time you have. Thank you again, Dr. Fernando, for everything that you've been doing every day. And thank you for watching and for your questions. And we're going to see you right here tomorrow night at 7 o'clock. Stay safe. I'm Stone Grissom. Good night.